have seen couples sit across from me after a failed IVF cycle and say, "We can't do this again. We feel foolish for trying. Maybe this is a sign we should stop." And I have also seen couples push through 5, 6, 7 cycles without anyone pausing to ask if it still makes medical sense. But both extremes are dangerous. So how many IVF cycles should you actually try before stopping? Let's talk what the data says and what it doesn't. IVF is not a one-shot treatment. One failed cycle feels final, but medically it is not. Large national registry studies published in the BMJ tracks tens of thousands of IVF cycles show something important. Success is cumulative. After one cycle, the live birth rates may range from 25 to 35% depending on age. But after 3 completed cycles, cumulative live birth rates increase significantly. In women under 35, cumulative success rates across multiple cycles can exceed 60%. That means stopping after one attempt may underestimate your true probability. But more cycles are not automatically better. Here's where we need to be honest. Age changes everything. Under 35, embryo chromosomal normality is higher. Repeating cycles can meaningfully increase cumulative probability. Between 35 to 38 years, cumulative benefits still exist, but strategy matters. Over 40, per cycle live birth rates drop significantly due to increased chromosomal abnormalities. In this group, repeating identical cycles without changing approach may not meaningfully improve outcomes. So the question is not about how many cycles in general. The real question is, does another cycle increase your probability, or are we repeating the same biology? When continuing makes sense. Continuing IVF is reasonable when you are producing more embryos, there are usable embryos, your age still supports a reasonable probability, and when there are no untreated uterine factors. In these situations, cumulative success justifies continued attempts. When reassessment is critical. Reassessment is necessary when there are repeated implantation failures, no embryos forming, or the egg reserve is severely diminished, age-related chromosomal risk is high. At that point, continuing without changing strategy becomes emotionally and financially costly. This may be where you should discuss options about changes in the protocol, genetic testing in selected cases, donor programs, or redefining goals becomes appropriate. Trying endlessly is not resilience, trying strategically is. To conclude, here is the disruptive truth. One failed IVF cycle does not mean you should stop, but more cycles are not automatically progress. The right number is not emotional, it is biological. The decision to continue should be based on age, embryo quality, and realistic probability, not fear, guilt, pressure, or blind hope. IVF is not about how long you can endure, it is about whether the next step meaningfully increases your chance of having a baby.